Hey, this is Hope Cook with Dermcast.live. I'm here today with Dr. Melissa Mauskar. She is an associate professor of OBGYN and dermatology at University of Texas Southwestern Medical Center. Welcome, Dr. Mauskar.
Thanks for having me.
Yeah, so I understand that you specialize and have a passion for vulvar dermatoses, but also for helping providers learn to have difficult conversations with patients.
Yeah, I've been working in dermatology for just over 10 years and found my passion for vulvar derm and gyne derm later on. But there's so many topics that both in my specialty practice, but just in general, that I think are really challenging to have some conversations with our patients. So I really just wanted to kind of spread awareness of things I've learned in my practice so that hopefully other people can incorporate that in theirs as well.
Yeah, and it fascinated me that I think you used the statistic 30% of dermatology patients or dermatology problems have a psychosocial component to them.
Yes, everything from, psoriasis. I use the example of a salesman that has psoriasis on his hands who's shaking hands with patients every day. I think sometimes we forget how, I even get the goosebumps.
Yeah.
I mean, how this can affect our patients, and I think when things, are obvious and people can see them, they can be distressing. But I think also those conditions that are hidden that people can't see, like our HS patients, like patients with psoriasis or atopic dermatitis that have genital involvement. I think it can really impact their, also those conditions that impact your relationships with people have a higher risk of depression, anxiety, that kind of stuff.
Yeah, and you mentioned that time is a limiting factor in addressing these issues.
Yes, I mean, I work in an academic practice. I do acknowledge, and I feel very fortunate that I get a little extra time to spend with these patients, and it's a referral center. So that's my job, is to try to figure out what's going on. But some people, you get 2, 5, 10 minutes with your patients. And I think that in this session, we really addressed that some of these conversations don't take as long as we think they will. We had a couple of vignettes that, were a minute and 40 seconds. And how much you can actually, walk in, see what's going on, get the lay of the land, and help give your patients resources.
Yeah. What are some things that providers can do, like from the second they walk in the room? What should their eyes be noticing?
So I think some things we can do are, notice your patient's posture. If I have a patient that is in pain, for instance, they're almost always laying down on the exam table with their legs up. But if they're sitting in the chair, notice if they're making eye contact with you or not, if they're looking down, the quality character of their voice, so that when you start examining them, I think just kind of looking at their skin, taking in all the clues, and the clues when people aren't speaking, like, those social cues and stuff.
And what are some questions that we could ask to sort of get the patients to open up more if we suspect they have depression or anxiety?
Yeah, so there's a really great screening model, PHQ-2, and some of the first 2 questions they mention are, have you been feeling down lately, or do you still, down or depressed, and do you, have you lost interest in things you used to do before? So those are 2 great initial screening questions. But I think also just asking them, wow, it looks like you have, psoriasis on your hands, or I guess kind of pivoting on that a little bit, when you do have patients with psoriasis or atopic dermatitis, up to 60% of patients also can have genital involvement, or it can affect other parts of their life, right? And so I think when you notice that your patient has just, regular plaque psoriasis, asking them if they have it anywhere else on their body, like in their genitals, on their penis or their vulva. And then if they say yes, you can acknowledge, wow, I've got lots of other patients that really impacts their quality of life and other things. So is that something you want to talk about more, or is that affecting you in that way?
I love that. Is that something you want to talk about more, because it sort of leaves the door open?
And sometimes they don't, right? And they're like, no, I'm okay. But I think other times you'll be really surprised with what you get from that question.
And while patients are undressed, it seems like it sort of also opens them up to vulnerability.
Absolutely.
And they seem to just start telling us
Yes.
stuff.
And I mentioned in the talk, and I think several people commented too. I mean, I think a lot of us see our patients more frequently than their PCP, their family practice doctor, and so they'll be much more willing to talk to you, you know, about things that they may not tell other people. So, like you said, they are in a vulnerable position, but you can really make a huge impact on them and maybe pick up things they're not willing to tell other people.
Yeah, I thought it was also fascinating how you said sort of which comes first, the chicken or the egg. Do the anxiety and depression lead to a worsening or a development of a chronic disease?
Yes.
Or does the chronic disease cause anxiety or depression?
Absolutely. I mean, there's so many ways it affects us. It's incredible, you know, the impact it has. And I think all of us know that, right? I think all of us know that this can, from our acne patients, the vitiligo patients, but it's like taking that next step and what can we do about it, right?
Yeah.
We acknowledge that maybe this is having an impact, but knowing that even though sometimes I feel like we're like, oh, just a skin doctor. I mean, half my practice is in the hospital, and so I do see patients with like really complex medical conditions, but a lot of times, you know, it's like, yes, I know I'm just the skin doctor, but I can spend a lot of time with you and talk about things and bring up things and start some of these medicines, right? That for depression, anxiety, that's okay. You know, I think talking along with their primary care doctor is important, but you know, a lot of these medicines we use for other things too, sometimes off-label, but I think there's a lot of impact we can have with these patients.
You mentioned specifically duloxetine.
Yes.
And you said it can help with chronic itch and kind of that
burning pain.
Yeah.
I use a lot of it in my practice. And I feel like everyone has their spiel of what they do to help patients get started on some of these medicines, but I tell them, you know, I have other patients that I've used this in that has really helped their, you know, burning pain or itch. A lot of doctors use this at high doses for antidepressant. But at lower doses, you know, starting at 20 milligrams, 40 milligrams, 60 milligrams, but even that 20 milligram dose sometimes can take the edge off of some of the symptoms you're having and have a little side effect of an antidepressant or anti-anxiety component that, you know, any patient with a long-term disease or someone that's been suffering for, you know, 2-5 years, you know, that's gonna make anybody anxious or frustrated. The more doctors, I mean, I'm in a practice where some patients go to 3 to 5 people before they come to me.
Oh, wow.
And so, you know, they've been, you know, jumping from family practice to urology to dermatology to gyne, and then they come into my specialty practice. And it's like, wow, like, if I had to go to that many people, I would be really frustrated, anxious, depressed, like not, you know. And so just realizing the impact I think we can have using these medicines.
So if you detect that a patient, or if they tell you flat out that they are depressed or anxious, what do we do about it?
Yeah, I think I personally tell patients, you know, this is the first time I'm meeting you.
Okay.
And, you know yourself better than I know you in this, you know, short visit. There's lots of things we can do to help with that. So there's, you know, exercise, mindfulness, lots of apps that we have right now. But there's also medicines we can start, or counselors. You know, do any of those sound appealing to you? Do you want to talk about them more? Are there medicines I can write down for you that you could look up? Some people will just say, yes, I know, please give me something. You know, that's not everybody. But I think, you know, telling them that you're interested, you want to help, you want to take a, you know, a holistic approach to their care. So I tell them, you know, yes, I want to get your skin better, but if we don't focus on some of these other things that are contributing to your symptoms, we're not going to get you to goal.
Yeah.
And I think just kind of coming up with the phrase that works in your practice will be good. But I think there's, you know, like I said, so much we can offer that sometimes I think we forget about.
Yeah, I found that patients sometimes seem more open to talking about stress. You know, I'll say, tell me about the role of stress in your life, and then they,
I love that.
You know, open up. But do you keep a list of phone numbers and a list of counselors available?
Yes, yeah. I have flyers for local shelters too.
Okay.
And I mean, I think what's hard, and I was talking about this last night with one of my colleagues, like a lot of counselors don't take insurance.
That's true.
And so a lot of times it's out of pocket. Where some of these apps, I mean, I don't think they work for everybody, but there are, you know, several, I think, through the pandemic that have made virtual counseling more available.
Yeah.
You know, but I think first looking at you know, your local area and seeing if there's people that you can refer. But I think keeping phone numbers, hotlines, that kind of stuff available. In like a quick phrase that you can just insert, and that let the patient look and see. And I tell them, you know, I think when you see a counselor, it's important to find someone that's a good fit. What might be a good fit for one person might not be for you. And so I think spending some time looking up, some patients are more internet savvy than others, but I think that if they are, they can kind of search around and see what would be a good fit.
Yeah, it's kind of like dating to find a good counselor. Exactly. What about our patients who are pickers? How do you approach that to figure out if, not if, but what the psycho?
Yes. I think some patients have insight into it.
Yeah.
Some people don't, right? And so I think it really depends on, you know, the underlying, is it, you know, a fiber that's coming out?
Yeah.
Or is it a sensation they're feeling, you know, or is it that they have a systemic, you know, malignancy underlying that's maybe causing them to itch, and then they get a little prurigo spot that they go on. So I guess that kind of helps set the stage. I think some people, we were actually talking about this at our grand rounds last week. You know, I think taking the approach of, you know, I can help you with the symptoms that you're feeling, and there's lots of medicines that can kind of help decrease those symptoms you're feeling, but we can't always determine the cause of what's happening.
That's a good point.
But I can help you with the symptoms. And so we might not be able to find out, you know, insert what fiber or bug, or, you know, I think there's a lot of conditions that can cause picking.
Yeah.
But we can get those symptoms better. And for itching or pain, other places too, in sensitive areas, I tell them, I don't want this to be driving your life anymore.
Oh, I like that.
So, I mean, this has been driving your life for a certain number of years. But let's, like, you know, focus on the symptoms you're having with that, so you can take care of your kids and do all the other things that, like, you know, all of us are balancing so much. So
I think it's so good that you just open up, you just open the pathway for patients to talk about the things that are really bothering them below the surface.
Yeah, I got the chills again. I don't know. It's one of those mornings.
Yeah.
No, I think the other thing we talked about is that, you know, I think over the last 3 years, all of us have been juggling so much, right? And every day it's like layering more and more and more on our plates. So I think taking the time to find out, like, what's meaningful for you in your practice. And for me, I really do and love, like, helping people feel more comfortable and talking about things that other people don't want to talk about.
Yeah.
And so I think that I find that very fulfilling and meaningful when we can kind of get down to the bottom of, oh, wow, the reason why your, you know, disease is not getting better isn't because you weren't given the right treatments, but it's because we couldn't figure out that you were basically like scrubbing your skin off, right? I mean, I think that it's kind of like digging a little deeper. And again, sometimes that takes a lot of time, and sometimes, I mean, you might have to do it over multiple visits, right? You might not get it at the first visit. Maybe you're just like setting the stage that first visit, and then you bring them back a little closer to time. That's one of the suggestions one of the participants made, what I thought was really great. You know, if you feel like there's something else going on, that maybe it's just like you're just hitting the tip of the iceberg, maybe you bring them back in 2 to 4 weeks. Check in again to build that rapport, and maybe after a couple visits, there'll be something else brewing that you can help with.
Yeah, I think at each visit they get to know us a little better and feel more comfortable sharing. Anything else you want providers or PAs to know as they go into the room and start to have these difficult conversations?
Yeah, I think one thing is just really making sure you have set some time, and I feel like if you walk in and you kind of sense that there's something else going on, or a patient says something that you weren't expecting, I think it's okay sometimes to step out of the room and kind of collect your thoughts. You know, don't feel like you have to tell them something right away. You can maybe listen and say, oh, you know, I'm going to step out a little bit. I'm going to look up one thing and I'll be right back. And I think it's okay for patients to hear you do that. Also, like I said, I think I've said like 8 times now, but just the impact. I mean, I feel like we can really help these patients. And I think don't underestimate the power you can have with the relationship that you have with your patients. And, you know, what they may tell you and the resources you can give them, and how they may open up to you. and that we're all in it together. And I think, working as a team is really important on a lot of different levels, but teaming up with your patient too and letting them know, I don't know if we can get down to the bottom of this right now today, but let me help you, give you some resources, let's circle back next time we see each other.
Yeah, that's such good information. Thank you for coming today.
Yeah, thanks for having me. This is great.
Yeah. This is Hope Cook with Dermcast.live, coming to you from Austin, Texas. See you next time.